Good morning. I'd like to acknowledge that we're on the land of the Gadigal Wongal people, the traditional custodians of this land. And obviously they've been here for tens of thousands of years, and imagine from our footsteps today how many millions of footsteps we will be following on this land. So I'd like to acknowledge those ancestors and the people who've gone before us, and their elders now and their community leaders now, and also the young Gadigal people coming forward as well, and all the other deadly young Aboriginal and Torres Strait Islander people we've got in this country. So I'd like to thank you all for coming here today, because to me, as a Wiradjuri descendant, it is a sign that we've got friends and followers in this country. And for those of you who don't know, I'm Megan Williams, or Meg, most people call me, and I'm the head of the Girra Indigenous Health Discipline in the Graduate School of Health at UTS. And I'm also a commissioning editor of Croakey, and are very, very fond of walking. So for me, walking as a public health activity, crossing over into journalism just blows my mind. So yeah, really thrilled to be here. And I might now hand over to Melissa, who's going to introduce Croakey, our partner for today, and also Frontyard.
Okay. This is how we roll at Croakey, very chaotic. Hello everyone, thank you so much for joining us. Thanks Meg for the lovely acknowledgement and introduction. It's terrific to see a group of people turning up, committed to health, to talking, engaging in public dialogue around health. The purpose of today is to bring people together who share a commitment from diverse backgrounds, diverse interests, so that we can come together, share news, share views, and also engage other people online. So we'll go around the circle and love to hear, where you're from. I've just driven up this morning from sort of corner of Girra country in the Southern Highlands, and I know other people will have come from all different places as well. As we go round, just invite you to reflect upon a health issue that's been on your mind this past week. It's been a very big week of news for health, when you think we had the IPCC report highlighting climate change. We've had human rights issues forefront with the terrible abuses of children and refugees, human rights and wellbeing. So many conferences this week. We've had an International Hospital Conference in Brisbane. We've had Mental Health Consumers Conference in Melbourne last night. You can see Mari McInerney's reports on Twitter. So many more. So just please share your reflections on what this week has meant for you in terms of health and health news. And now I'd like to throw to Luke Bacon from Frontyard, a beautiful spot in Marrickville where we're gathering. And Luke, can you please introduce yourself and tell us a little bit about where we are?
Hello. Welcome to Frontyard. I'd also like to acknowledge the Gadigal people of the Eora Nation, acknowledge that this land that we're on and that Frontyard is on was never ceded, and particularly talking about the use of public space, which Frontyard's really engaged with in this country. That needs to be a decolonising discussion. We're very into that at Frontyard, and it's great to have that happening here as well. So Frontyard is it's hard to describe, and there's lots of different descriptions of it, but it's a space for critical, creative research and free thinking, and getting together with people and doing exactly these types of events. It's public space. This is Inner West Council space. It's supported by the Inner West Council do a peppercorn rent program. It's been here for 2.5 years, and there's 2 residency rooms inside that people can take over for 1 or 2 weeks to do or not do whatever they need to do in their lives. One of the things we really talk about is the pressure on people to always be producing, and if people want to take over space here and not do anything for 1 or 2 weeks, that's really important part of Frontyard. But there's also workshop space. There's also planes always over Marrickville, and a library, and there's reading groups, and lots going on here. Gardens. So if you're ever in the area and need some parsley or any food, kind of swing by and it's space to get involved with, and it's exactly for this type of thing. So thanks for having this here.
Hi, my name's Hanari Deegan. This afternoon I'll be giving the FOI workshop on uncovering secrets around public health. One of the things that's been on my mind recently is the impact of the WestConnex motorway construction and operation. And so with a group of many other community members, we've been building a low-cost citizen science network of air quality monitors. And so hopefully today on our walk we'll be visiting one of those monitors, and also one of the people that lives in a house that is affected by the pollution that's being caused by the WestConnex motorway construction and operation. So yeah, that's me.
And we just missed someone here, I noticed, in the circle.
Hi, I'm Chris Nash. I've got an association with Frontyard, particularly through Luke and Hanari. A journalist originally and an academic, and now quite involved with the WestConnex issue that Hanari just talked about, and particularly the air quality. In terms of, apart from that, in terms of current issues, last night I saw a documentary, The Island of Hungry Ghosts, at the Antenna Documentary Festival in Sydney, and it involved the work of a health professional woman called Pu Lin Lee, who is a narrative therapist working with asylum seekers on Christmas Island. So quite a poetic film, but the film conveyed very strongly the humanity of these people, because it included some of their therapy sessions where they were talking about their situation. And I can tell you, you come out of that film, first of all, absolutely loathing in a deeply visceral sense the people who purport to be our politicians and our leaders, and you absolutely understand that this asylum seeker issue is about racism, pure, simple, undiluted racism. It is about these people being projected as subhuman, and as soon as you see the humanity, it's overwhelming that is actually what it's about. So I'm quite interested in what Croakey does, obviously, in terms of race and Aboriginality and health, and I think this asylum seeker issue links very strongly to that. Apart from that, I'm a former journalist, and I really like the idea of journalism and walking. I'm really interested to see what happens there.
Excellent. Thanks, Chris, for taking this round.
Hi, my name's Stephen Foe. I'm a clinical academic, and I'm also here on behalf of my wife, who does academic work at UTS and is a small businesswoman who focuses on the health systems all around the world, including our own, which she purports is one of the best. My interest is in trying to bring the humanity of what people in asylum are suffering with at the moment to the public fore, and I'm doing some research on pain management in refugees in detention, which I'm hoping to continue. So thanks for that.
Thanks, Stephen, and thanks for the shout out to Margaret. We really appreciate it.
Hi, I'm Martin. I'm just here as a +1 with my wife.
But, you know, I'm sure health matters to you. If it's not your day job, health is an intensely personal matter for people as well. So are there any health issues you would like to raise or that will be on your mind as we walk?
Nothing particular,
Okay.
It's more interested in talking about the All Blacks. My name's Liz Sullivan. I'm a Professor of Public Health at UTS, and this is my first walk with Croakey, so I'm very excited in walking journalism. I'm particularly interested in issues around incarceration and mothers in prison, and about the systemic over-incarceration of young Aboriginal people, and particularly young Aboriginal women.
Thank you. My name's John Wardle. I work with Liz at the Discipline of Public Health at UTS. There's so many issues, I guess. Trying to narrow it down is a bit hard, but I'm particularly interested in law as a determinant of health, and I think that's really come to the forum with Kavanagh, the whole saga of that, the new private health insurance changes, which really are about privatisation of primary care, and of course just the indefinite detention of asylum seekers is something that's actually enabled by law itself. So, yeah, thanks. And this is Molly. She is very interested in health, but also very much something that we try and look after health for.
Fantastic. Thank you both for coming. Hello, Molly.
Hi, I'm Catherine Carpenter, and I work for the Law and Justice Foundation of New South Wales. So I'm really passionate about access to justice issues and how those interact with health, but I'm here today in a personal capacity with my partner.
Thank you so much.
Hi, my name is Mark Ragg. Sort of joining up with what Catherine was saying, I've been thinking about the health of people in remote communities recently, and had a trip to Burke and Brewarrina with the Civil Law Service for Aboriginal Communities, and thinking about how the access to justice, which is coming up a lot, it ties in with the health and well-being of people there. So it's interesting. Thank you.
Justice is such a strong theme, isn't it? Lack of justice.
Hi, I'm Leslie Russell. I'm at the Menzies Centre for Health Policy at the University of Sydney. As a dual Australian-American citizen, I have to worry about bad politics on 2 continents. And goodness knows there's enough to worry about. Just this week I had a piece published, an inside story about how Trump is dismantling science and the consequences of that on health and the environment, and I'm seeing that reflected exactly in Australia at the moment.
Hello, my name's Mel Conya. I work in my own private practice, a mixture of therapy, counselling, consulting and training. My interest is at that intersection of human rights and well-being, in that my belief and observation is that healing is not possible without justice, and that as those of us working in a therapeutic space, I believe that we're working at the intersection between systems of oppression and the suffering that it gives rise to in people's lives. So my interest is in walking with others who hold justice in the centre of health and healing, who turn to look at how we sustain ourselves in walking alongside others who bear the full brunt of the oppressive practices in our society. Thank you.
Thank you. Hi, I'm Jude Page. I've been involved in public health for many years, including particularly air quality at the moment, and I'm partly involved in the citizen science project that Chris mentioned. Thank you.
Hi, I'm Paula O'Connell. I've been working with Croakey to help make it more sustainable from a financial perspective. So my interest in health is very broad, and I like to be able to support it from all the passion that all of you have, to be able to get that down in print and to be able to get that through to more people overall. Yeah.
Hi, I'm Julie Leask, and I'm an academic in the Sydney Nursing School at the University of Sydney, and I'm a public health person. I've been thinking this week about how you translate evidence into practice, because I've got a lecture coming up next week which is on implementing evidence-based practice and what sort of frameworks help structure that for nurses who aren't necessarily used to behaviour change and implementing evidence. So that's my challenge for the week around health.
I'm Mitchell Ward. I'm the creative director and web developer of Croakey, and this has probably been about my 5th or 6th Croakey go. Always great to meet lots of different people from lots of different fields, but all interested in that health aspect, and particularly interested in public interest journalism, which in the current climate is more and more important, so that's what I'm supporting.
Hi, my name is Matt Campora. I'm very humbled to be in the presence of this group of very interesting people, and also very interested to join in on this health walk today. So thanks for the invitation, and glad to be here.
Hi, I'm Sally Thompson-Campora. I work for an organisation that works with young people. We work with young people who are increasingly presenting at risk in terms of their mental health. Most of the services that we run work with either families that are homeless within sort of the demographic or the age range between 15 to 25, or with young people who are unemployed. And I'm very passionate about young people and their mental health, and it's great to be here today just to hear from everyone and also share in this experience. So thank you.
Hi, I'm Ruth Armstrong. I'm one of the Croakey editors, and I come from Balmain, so I'm also on Wongal and Gadigal land as well. So it's just amazing to be here, traversing a bit more of that country today. There are so many public health issues I could mention. I guess what's been on my mind this week is some of the revelations about people in the construction industry getting silicosis from cutting stone bench tops. I think this is probably going to be a bigger disaster than we realise, and it's a huge issue that sort of intersects public health and industrial laws and industrial conditions and human rights, I think. So watch this space.
Great. Well, thanks everyone for introducing yourselves. And airplane. That's my alarm clock. Most mornings I live nearby. Just 6:15 they start. So obviously we're in the urban environment and we're about to go for a walk in a really full-on urban environment. So just wanted to, I guess, identify that Croakey's walked in a lot of different areas but not in such a full-on urban environment like this. So do take care. I think I'm one of the leaders. I have a terrible sense of direction even though I'm local. We have practiced this walk and I've checked out the maps. But really this is about sticking together as who we are as people and our principles and the reasons that have brought us here today, but literally sticking together kind of on the footpaths, not in front of cars. Maybe we'll cross at the lights together as much as possible. But also...
Very un-Marrickville.
Yeah. Well, Newtown, it's a $180 fine if the coppers are there, so be very careful up that way. And if you have any questions along the way, do feel free to ask. You may want to tweet us a private message so that we can capture you. But also do tweet at #CroakeyGo. And one time we trended nationally on one of our Croakey Goes, so who knows what's possible today. And are there any questions people have right now? And anything else you think to mention? Okay, wonderful. Well, there's plenty of material about Croakey Go at the hashtag and on the Croakey website as well. And so some pictures and quotes from today will also join that beautiful repository of citizen science and citizen walking as an act of public health journalism. So thanks again. It's a real privilege to have all of you here. Airplane.
I'd say there's a kitchen inside and bathrooms and anyway.